Lydia, you rubbing your chest. Are you feeling okay?
My chest is hurting.
It's hurting.
Yeah. Should I go to the ER?
Oh, well, I mean, it looks like you're lifting weights. How long you been lifting weights?
A couple days, I guess.
Couple days? You training for something, or?
Yeah, I started, I think, like Tuesday for soccer. So we've been trying to lift weights to get in shape.
Okay. Do you have a history of anything cardiac or respiratory, anything like that?
It just started hurting.
Just started hurting?
Yeah.
I think you're okay. Might be costochondritis.
So what is costochondritis? It's point tenderness of the costal cartilages along the sternal border. This pain most often occurs where the ribs meet the breastbone. Most common areas between the second and fifth costochondral junction. Some considerations. This condition is more common in women. 70% of women present with this as opposed to only 30% men. Most commonly presents in patients between the ages of 10 to 21, and it's more predominantly on the left side. Risk factors, exercise, especially upper body exercises. Has the patient had any recent trauma, like a fender bender or anything like that? Have they had a recent upper respiratory infection where they've been frequently coughing or sneezing? These are some of the common causes, but experts say the definitive cause is still unknown. Here are three key questions during your health history. Describe your pain. Usually with these patients, point tenderness between the second and fifth costochondral junction, very tender to touch, radiates down the left side, and it's sharp and stabbing. You want to ask the patient, how does breathing impact it? Usually their pain is exacerbated by deep inspiration, so sometimes they don't want to deep breathe because of the pain. And then you want to ask them, what's different with you? Did you start a new exercise program? Have you had any recent trauma? Have you been sick lately? What's going on? Three key physical exam components. Is the pain reproducible? As the practitioner, can you make the patient have the same type of pain? If you can't do it just by doing basic point tenderness, and keep in mind these patients should only have point tenderness in the costochondral area, you want to do a costochondritis test, which would be like the crowing rooster maneuver and horizontal arm traction. We'll go over that. And then during your key physical exam and health history, you want to rule out any sort of edema, cardiac or respiratory findings, autoimmune history. Usually with these patients, you're not suspecting this, but you're going to rule it out anyway. Here's the crowing rooster maneuver. Have the patient put their arms behind their head and you pull, do a little bit of traction, should elicit pain near the breastbone. Or you could do horizontal arm traction where they flex their arm across the anterior chest and you push against the opposite shoulder. That should also elicit pain at the breastbone area.
So with costochondritis, big thing that we're looking for is that it's reproducible. So that hurts when we push on it, okay?
Yeah.
Does it radiate at all?
Yeah, it kind of goes like down this way.
Okay. Is it more like a sharp pain?
Yeah.
Okay, so sharp, radiating, reproducible, more than likely costochondritis. No history, right age. How old are you?
17.
17. Perfect age between 10 and 21.
So how do we treat these patients? Number one, rest. Limit the physical activity. You can advise a heating pad, sometimes alternate heat and ice. Anti-inflammatory, such as ibuprofen and Tylenol for pain. And then you can do 1% Voltaren, which is a topical anti-inflammatory agent. You can do 2 grams of gel as needed to the affected area 4 times a day. Then you can also encourage some stretching exercises. This is one that's very good for opening up that area. You can put your arm at a 90-degree angle against the wall and then turn your body away from the arm. That should open up the patient. They can do this up to 20 times a day. Hold each stretch for 30 seconds. And then your 3 priority teaching components. Rest. If it aggravates, don't do it. Your goal is to decrease the inflammation. Use the topical and oral anti-inflammatory agents as prescribed. Alternate the ice and heat. Stretch it out. And then lastly, these patients tend to have a little bit of anxiety because they feel chest wall is heart related. You want to educate and reemphasize it's not cardiac, it's musculoskeletal. This condition could linger for 6 to 12 months. So you want to really push the patient to do all they can to decrease the inflammation with stretching, resting, and then using their anti-inflammatory agents. And then if they're just anxious, they can follow up every 4 to 6 weeks and you can reevaluate treatment. Worst case, they could always be referred for more of a kind of a nerve block kind of thing. And that is it.